Hi, this is almost everything you'll need to know about the arm, Part 2, Neurovascular Edition. We're looking here at the posterior aspect of the arm, and we see our familiar landmarks, the teres major muscle, the long head of triceps, and the two intermuscular septa, medial and lateral. And the first structure we'll consider is the radial nerve. The radial nerve exits the axilla by passing laterally and inferiorly into the arm, but then immediately traverses this triangular hiatus here to move from the anterior to the posterior arm. This hiatus doesn't have an official name, unlike the triangular and quadrangular spaces above it, which I'll just draw in for revision purposes. So the triangular and quadrangular spaces are related to the upper border of teres major between it and the lower border of teres minor, which is just drawn in here. So this is the triangular space, its actual anatomical name, and this is the quadrangular space. This space here, unnamed, sometimes referred to as a triangular hiatus. In any case, the large radial nerve emerges through this hiatus and crosses the posterior shaft of the humerus obliquely in the spiral groove, and then comes to lie on the lateral intermuscular septum. The radial nerve supplies the muscles of the posterior compartment, which is all the heads of triceps and anconeus. But as it lies on the lateral intermuscular septum, it does a very strange thing, which is to pierce the septum and then run in the anterior compartment to cross the elbow. It's very strange for this nerve, which is all posterior divisions of the brachial plexus and is the nerve that supplies the posterior compartments of both the arm and forearm, to run in the anterior compartment. It doesn't really make a lot of sense. While it's there, it does give a cheeky branch to brachialis, which is very odd because brachialis is the prime flexor muscle of the elbow, so pretty unheard of. Even stranger is that the ulnar nerve, which is in the anterior compartment in the medial part of the arm, passes along onto the medial intermuscular septum anteriorly and then pierces the septum to pass into the posterior compartment and crosses the elbow posteriorly in its familiar position in the groove at the back of the medial epicondyle of the humerus, where it's relatively well protected, but it still occasionally gets bashed and gives the unpleasant sensation of being hit in the funny bone, which is highly inaccurate because it's not funny, well, it's not ha-ha funny, and it's not a bone. Anyway, very strange behavior from these two nerves, the ulnar nerve and the radial nerve. The artery of the posterior compartment of the forearm is the deep brachial or profunda brachii artery, which follows the radial nerve through the hiatus here. It's the only branch of the brachial artery that we'll need to concern ourselves with. It runs posterior to the nerve, or superficial to it if you're burrowing in from behind, and supplies all of the muscles in the posterior compartment. To help you understand the relationships at the proximal part here between the teres minor, teres major, and long head of triceps muscles, you can build a little model of it with your hands, as shown in this picture. We'll turn now to this anterior view. I will just draw in the radial nerve again. Its radical little branch here to brachialis. If we draw in the brachial artery now, that is the continuation of the axillary artery, simply renamed as it crosses the lower border of teres major to enter the arm. It runs just anterior to the anterior intermuscular septum in the medial aspect of the arm. It gives off its major branch, which is the deep brachial or profunda brachii artery, which follows the radial nerve through that triangular hiatus and runs posterior to the radial nerve, as we saw. We saw the ulnar nerve traveling medial to the brachial artery and piercing the medial intermuscular septum to cross the elbow joint posteriorly. The median nerve is formed anterior to the axillary artery and continues to run on top of the artery as it becomes the brachial artery, and only slides off medially as it approaches the cubital fossa and enters the cubital fossa medial to the brachial artery. It was formed by two roots, one from the medial cord and one from the lateral cord. The other branch of the lateral cord is the musculocutaneous nerve, which travels a short distance laterally in the axilla before entering the rather scrawny belly of coracobrachialis. It runs through the muscle substance of coracobrachialis, then emerges onto the anterior surface of the brachialis muscle and travels on top of brachialis, sandwiched between it and biceps. The biceps brachii muscle covers most of these nerves, helping to protect them in the arm, but they become relatively exposed as the biceps muscle tapers to its distal tendon, so that they can all be seen with relative ease in the cubital fossa, which is the tissue space we'll consider in the next video. So we see that these four major nerves carry on distally beyond the arm. The radial nerve will regain its position posteriorly and supply the posterior muscles of the forearm. The median nerve will carry on into the anterior compartment of the forearm and supply many of the flexor muscles there. Neither the median nerve or the ulnar nerve supply any structures in the arm. They're simply continued to the forearm. The ulnar nerve will regain its position in the anterior compartment and supply 1.5 muscles there. The musculocutaneous nerve, after supplying coracobrachialis, brachialis, and biceps brachii, supplies no further muscles, but it does continue into the forearm as a purely cutaneous branch, which is the lateral cutaneous nerve of the forearm. So from its name, musculocutaneous, the muscular portion is entirely in the arm and the cutaneous portion is entirely in the forearm. We have the medial cutaneous nerve of the arm, which supplies the skin on the medial part of the arm, and the medial cutaneous nerve of the forearm, which travels medially, becomes more cutaneous and completes the cutaneous nerve supply of the forearm. So that's all of the structures that we need to see in the arm. As always, we can look at some surface anatomy. Again, in one of New Zealand's premier netballers, this is Laura Langham. We can see in this astonishing athlete both heads of the biceps separated proximally. We would imagine coracobrachialis emerging here, which you see teres major and latissimus dorsi, and triceps here. Pectoralis major arching over the proximal part of the biceps muscle. And now we'll be aware that the brachial artery will be travelling between biceps and triceps here, with the median nerve plastered to it. Finally, there's actually this very good diagram in your book which helps to illustrate the relationships of the neurovascular structures to the fascia in the compartments. So I would recommend you study that. But that concludes our review of the anatomy of the arm, both the muscular and neurovascular structures. I hope you found that informative. We'll continue with the cubital fossa, which is the tissue space between the arm and the forearm, in the next video. But until then, enjoy the rest of your day.